Picture this for a moment. It's 2:17 in the morning, the house is quiet, everyone else is asleep. But you are wide awake, sitting on the edge of your bed with your hand pressed against your lower abdomen because something feels wrong. Not just uncomfortable, wrong. You already tried the bathroom 3 times tonight. Each time, the same frustrating cycle. You sit down, you wait, you strain a little. Maybe a tiny amount comes out, maybe nothing at all. But the pressure never leaves. In fact, it feels worse every hour. Now your stomach feels swollen, tight, heavy. Your lower back aches. You cannot get comfortable no matter how you sit or lie down. And then something strange starts happening. You suddenly feel moisture in your underwear or notice watery stool leaking out. And for a moment you think, wait, maybe this isn't constipation after all. Maybe it's diarrhea. But deep down, your body knows better. Because despite that leakage, despite the pressure, you still feel full, blocked, stuck. If that sounds familiar, I need you to stay with me very carefully today because what we are talking about is a dangerous medical emergency. My name is Dr. Bianca, and today we are going to talk openly about stool that becomes trapped inside the rectum. What causes it? Why it becomes so painful? Why older adults are especially vulnerable? And what you should do before it becomes life-threatening. And I know this is not a glamorous topic. Nobody wants to discuss bowel movements. People would rather talk about almost anything else. But here is the truth. Thousands of adults end up in emergency rooms every single day because they waited too long. They felt too embarrassed or misunderstood the warning signs their bodies were desperately trying to send them. Many people do not realize how serious this can become until they are vomiting, unable to urinate, or facing emergency surgery. So today, we are going to remove the embarrassment from the conversation and replace it with understanding. Because once you understand what is actually happening inside your body, everything starts making sense. And before we dive in, I want to hear from you. Tell me where you are watching from today. I love seeing our global community. Now let's start with the most important thing first. What exactly does it mean when stool gets stuck in the rectum? The medical term is fecal impaction, but honestly, medical terminology often makes things sound colder than they really are. So let me explain it in simple human language. Your digestive system is designed like a long-moving conveyor belt. Food enters at the top, nutrients get absorbed along the way, and the waste continues traveling until it exits the body. But your colon has a very important job during that journey. It removes water. That is normal. That is healthy. The problem begins when stool stays inside the colon or rectum too long. Because the longer it sits there, the more water is pulled out. Hour after hour, day after day, and eventually, what was once soft stool becomes dry, dense, and difficult to move. Think about wet cement. At first, it is soft and moldable, but leave it alone long enough and it hardens into solid. That is exactly what can happen inside the rectum. And once that hardened mass forms, the body struggles to push it out naturally. Now here is something very important. This usually does not happen overnight. Most fecal impactions develop very slowly. In fact, many people are already impacted for several days before they fully understand what is happening. At first, it may just feel like mild constipation. You skip one bowel movement, then another, you feel slightly bloated. Maybe you lose your appetite a little. You feel sluggish, heavy, uncomfortable. But you can still pass tiny amounts of stool, so you convince yourself everything is probably okay. That is one of the biggest mistakes people make. Because partial blockage can still allow small amounts of stool or liquid to pass around the hardened mass. So people assume things are moving, when in reality, a dangerous obstruction is quietly growing inside them. And this is especially common after age 60. Now I want to pause here because this part matters enormously. If you are over 60, your digestive system is not the same digestive system you had at 25. And that is not criticism, that is biology. As we age, the muscles inside the intestines naturally slow down. The contractions that normally move stool forward become weaker and less coordinated. The body also becomes more sensitive to dehydration. At the same time, many older adults take medications that dramatically slow bowel movement without even realizing it. Pain medications, iron tablets, calcium supplements, certain blood pressure medications, sleep medications, antidepressants, antihistamines. Some of these drugs can slow the intestines so much that stool begins sitting inside the colon for far too long. And then there is another issue almost nobody talks about. Older adults often stop feeling thirst properly. This is incredibly important. Many seniors are dehydrated without realizing it because the brain no longer sends strong thirst signals the way it once did. So they drink less water. The colon pulls even more moisture from the stool. And suddenly the perfect conditions for fecal impaction are created. This is why I always tell my older patients something very important. Constipation is not just about the bathroom. It is about hydration, movement, muscle function, nerve signaling, medication effects, aging, and daily habits, all working together. Now, let's talk about the symptoms because this is where things become dangerously confusing. The body often sends warning signs that people completely misinterpret. And I want you to understand these signs clearly because recognizing them early can prevent a medical emergency later. The first symptom is persistent rectal pressure, not just constipation, pressure. A heavy sensation deep in the pelvis that never fully goes away. Many people describe it as feeling like they constantly need to have a bowel movement but cannot complete one. They sit on the toilet repeatedly throughout the day, tiny amounts may come out, but the sensation of fullness remains. And sometimes the pressure becomes so intense that sitting itself becomes painful. The second symptom is abdominal bloating. Your lower stomach may begin looking swollen or distended. Clothing suddenly feels tighter. You may feel unusually full after eating very little. And because the intestines are slowing down, gas begins accumulating as well. That creates cramping, pressure, and discomfort that can become severe. The third symptom is one of the strangest and most misunderstood, watery diarrhea. Now, this surprises people every single time. They think, how could I possibly be blocked if I have diarrhea? But here's what actually happens. When a hard mass blocks the rectum, newer liquid stool from higher in the colon still needs somewhere to go. So instead of moving normally, it leaks around the edges of the obstruction. That liquid escapes as watery diarrhea. This is called overflow diarrhea. And it fools people constantly. Some individuals even take anti-diarrheal medications at this point, which can make the situation dramatically worse. Because those medications slow the intestines even further. So please hear me clearly. If you have watery stool combined with rectal pressure, bloating, and difficulty passing normal stool, do not automatically assume you have a stomach virus. Your body may actually be severely constipated. The fourth symptom is nausea. As stool backs up inside the digestive tract, the entire system begins slowing down. Food sits longer in the stomach, the intestines become distended. The internal pressure begins building upward throughout the body, and many people begin feeling nauseated or lose their appetite completely. Some eventually begin vomiting. And once vomiting starts alongside severe constipation, that is a major red flag. Now let's talk about a symptom that shocks almost everyone. Difficulty urinating. This happens more often than people realize. Your rectum and bladder sit very close together inside the pelvis. When the rectum becomes massively filled and swollen, it can physically press against the bladder and urethra. As a result, people suddenly find themselves unable to empty their bladder properly. They feel urgency but only pass tiny amounts of urine, or they feel pressure and pain while urinating. In severe cases, complete urinary retention can happen, and that itself becomes a medical emergency. Then there is another symptom people rarely connect to constipation: lower back pain, not sharp pain, a deep aching pressure across the lower spine or hips. Many people assume they strained a muscle. Others think it is arthritis. But severe rectal distension can radiate pain into the lower back, pelvis, and even the thighs. And finally, there is one symptom that families often notice before the patient does: confusion. Especially in elderly adults, severe constipation and bowel obstruction can place enormous stress on the body. Older adults may suddenly seem disoriented, agitated, weak, or mentally off. Sometimes family members think their loved one is developing dementia or having a neurological event. But in some cases, the underlying trigger is actually severe fecal impaction combined with dehydration and physical stress. That is why bowel health in older adults matters so much more than people realize. Now, I want to explain something that may genuinely save someone's life. A fecal impaction is not just uncomfortable, it can become dangerous very quickly. And I need you to understand what happens if the blockage continues worsening. At first, the intestines simply stretch, the pressure builds. The muscles strain harder trying to push stool forward. But eventually, the bowel begins losing its ability to contract effectively. The intestine becomes sluggish and exhausted. Then the blockage grows larger. Gas and fluid accumulate above it. The abdomen becomes increasingly swollen. Pain intensifies. Nausea worsens. The person becomes weak, sweaty, and ill. And if the pressure becomes extreme, the bowel wall can actually tear. This is called perforation. And when that happens, bacteria and waste leak into the abdominal cavity. That causes a massive infection called peritonitis. Without emergency surgery, peritonitis can become fatal. So when should someone stop trying home remedies and seek immediate medical attention? I want you to remember these warning signs carefully. Severe abdominal pain that does not improve. A swollen, rigid abdomen. Vomiting, fever, complete inability to pass gas. Blood in the stool. Severe weakness or confusion, or inability to urinate. Those are not wait until tomorrow symptoms. Those are emergency room symptoms. Now at this point, some people listening are probably thinking, okay, Dr. Bianca, but what do I actually do if this is happening to me right now? So let's talk about practical steps. And the first thing I need you to stop doing is excessive straining. Seriously, stop forcing. Most people think pushing harder will solve the problem. But when stool is severely hardened, aggressive straining often makes things worse. It increases pressure inside the rectum, it inflames tissue, it worsens hemorrhoids, and in older adults with heart disease or high blood pressure, severe straining can even trigger dangerous cardiovascular stress. Your goal is not force. Your goal is softening and relaxation. That changes everything. One of the most commonly recommended first-line options for lower rectal impaction is a glycerin suppository. These work by drawing moisture into the stool and lubricating the rectal area. But there is something important people often do incorrectly. They use one suppository, wait 5 minutes, get frustrated, and assume it failed. That is not how these products work. The suppository needs time. The body needs time. And positioning matters. Lying on the left side often helps because it aligns the rectum and lower colon more naturally. Many people also benefit from applying water-based lubricant beforehand because the tissues may already be irritated. But if symptoms are severe, persistent, or worsening, professional medical evaluation becomes essential. And sometimes people require stronger medical interventions like enemas, imaging studies, or manual disimpaction performed by healthcare professionals. Now, I also want to talk about prevention because honestly, prevention matters far more than emergency treatment. Once someone experiences a severe fecal impaction, they become much more likely to experience another one later. So the long-term habits matter enormously, and the first habit is hydration. Not coffee, not soda, water. Your colon cannot produce soft stool without enough fluid. It is physically impossible. One of the best habits you can build is drinking water consistently throughout the day instead of waiting until you feel thirsty. And I especially encourage older adults to drink water earlier in the day because nighttime dehydration becomes a huge contributor to constipation. The second habit is movement. Your intestines respond to physical activity. Walking stimulates bowel contractions. Even gentle daily movement can dramatically improve digestion. And this becomes critically important for seniors who spend long periods sitting or lying down. The third habit is fiber, but this is where nuance matters. Fiber helps many people tremendously. Vegetables, fruit, oats, beans, whole grains. But here is the important part. Fiber without water can actually worsen constipation. If you add large amounts of fiber while remaining dehydrated, stool can become bulkier and harder to pass. So hydration and fiber must work together. The fourth habit is respecting the urge to go. This sounds simple, but it matters more than people realize. Many people ignore bowel urges because they are busy, driving, shopping, working, or embarrassed to use public restrooms. But repeatedly delaying bowel movements teaches the rectum to stretch and become less sensitive over time. Eventually, the body stops signaling properly, and constipation gradually worsens. The fifth habit is reviewing medications regularly with your doctor. I cannot emphasize this enough. Many people suffer chronic constipation for years without realizing the cause may be sitting inside their medicine cabinet. Sometimes adjusting a medication, dosage, or schedule can dramatically improve bowel function. And finally, let's talk about something simple that actually helps many people significantly. Toilet posture. Humans were originally designed to eliminate in a squatting position. Modern toilets place the body at a less natural angle. Using a small footstool under the feet can elevate the knees and straighten the rectal pathway, making bowel movements easier and reducing straining. It sounds almost too simple, but for some people, it makes a remarkable difference. Now, before we finish today, I want to speak directly to caregivers for a moment. Because some of you are not listening for yourselves. You are listening because you are worried about a parent, spouse, or loved one. And caregivers are often the first people to notice the warning signs. An elderly parent who has not had a proper bowel movement in days, someone suddenly refusing meals, a loved one complaining of abdominal pressure or back pain, a normally calm person becoming confused or agitated. These signs matter. Please do not dismiss them. Especially in frail older adults, constipation can spiral into serious complications much faster than most people expect. And there is no shame in seeking medical help for bowel issues. Doctors and nurses deal with this constantly. Truly, this is incredibly common. What matters is addressing it early before complications develop. We covered a lot today, so let me leave you with the most important message I hope you remember. Stool stuck in the rectum is not just bad constipation. It is a serious condition that can become dangerous if ignored. Your body usually sends warning signs long before an emergency develops. Pressure, bloating, difficulty passing stool, overflow diarrhea, back pain, urinary problems, nausea, confusion in older adults. These symptoms matter. Listen to them. And please remember this too. Your digestive health affects far more than your bathroom habits. It affects your energy, your comfort, your appetite, your sleep, your mobility, even your mental clarity. This is not a small issue. And you deserve to understand what your body is trying to tell you. If today's conversation helped you, make sure you share it with someone who may need this information because there are many people suffering silently. With this problem right now, too embarrassed to ask questions or seek help. And honestly, those are often the people most at risk. Take care of yourself. Drink your water, move your body, and never ignore persistent constipation your body is struggling to resolve.